This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, and on Facebook at TTT Live Online. We go now to the Minister of Communication, Donna Cox.
Good morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terrence Deyalsingh, the Chief Medical Officer, Dr. Roshan Parasram, and the Minister of National Security, the Honorable Stuart Young. The Minister of Health, the Honorable Terrence Deyalsingh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to my colleague, Minister Young, Chief Medical Officer. Very good morning, although rainy this morning, to members of the media and wherever you are in Trinidad and Tobago and the world, listening, viewing on the web. Very pleasant good morning to you. Ladies and gentlemen, the world has once again reached a milestone which was predicted of 16,022,035 cases. We have breached the 16 millionth case. It was just a few days ago we had touched 15 million. And in the space of about 3 or 4 days, we have added another million cases to the total caseload around the world. So the pandemic is not slowing down, it is actually picking up speed. Today, the total number of deaths, unfortunately, 644,055. I would normally give you an update on the daily new cases and the daily deaths. Unfortunately, the daily new cases is now touching, just within touching distance, of 300 cases per day. For those who were tracking these conferences and tracking the figures that we were given, in the past month or so, month and a half, it was 100,000, average 150, started to average 175, then 200. Now we are within touching distance of 300,000 cases per day. What was happening with deaths was that you saw a peak of deaths around March, April, and then luckily, deaths started to go down around May, June, and so on. Unfortunately now, the trend in deaths is now picking up once again. When we couple this with the sobering reality of what we have faced with recent developments in Trinidad and Tobago, it should be a wake-up call for us in Trinidad and Tobago that, as predicted, the virus is still with us. And as we said, once we start to reopen the economy and people start to move and go back to work and start to go to social gatherings, the virus will move, as we said, and recent developments has borne that out. Collectively as a society, we may have dropped our guard, but now we have to recommit to the public health measures that are so simple but so vitally important, so that we could not only preserve lives, make sure people don't get ill, but the economic gains that we have made since we started to reopen the economy, those economic gains are not lost. We want to continue on a path. One of the things that we were looking at this weekend was starting to reopen the entertainment industry. We heard your cries, and we were on the verge of doing that. But events from Wednesday to today have now put that on the back burner. And I really feel for those in the entertainment industry. But the recent cases have necessitated a review of those plans. What we have seen is a localized closure of several businesses and one school, which is the responsible behavior by those business owners, and we thank them for their full cooperation. The banks, FCB, Republic, private sector, Pennywise, Better Deal Supermarket, Ramesh and Leela. We really want to congratulate them for their responsible behavior, and they were able to reopen in the shortest possible space of time. As we face this new upsurge in local cases, the healthcare system, the parallel healthcare system which we have in place, has the capacity to deal with any surge in cases. And that's why we did not give in to the temptation to use the parallel hospital system as a quarantine facility. We only used it once out of necessity for those people on the enchantment of the seas. I think the common sense and the logic in not giving in to the temptation to use our parallel healthcare facilities, that is Cora and Couva as quarantine facilities, could now be seen to be a wise move. Why? Because we now have to use those facilities for clinical treatment of patients. So let me give you an idea of what is happening now. In broad detail, the CMO will go into more granular levels. At Cora, by the end of the day, we will have about 13 persons there. That is 13 out of 100. So Cora, by the end of the day, will just be 13% occupied. So we have a lot of space there. At Couva, we have waiting in case we get an upsurge in cases, 175 beds available. So between Couva, 175 beds, and Cora, 100, a total of 13 out of 275 beds are in use, which is just below 5%. So the capacity that we have kept in reserve, knowing that we could always expect the virus to manifest itself, the parallel healthcare system is in place to treat with any upsurge in local COVID cases. Additionally, the normal healthcare service delivery goes on unabated, and that is the beauty of the parallel healthcare system. We don't have to disrupt normal operations in any of the hospitals. Eric Williams, Sangre Grande, San Fernando, Port of Spain. That goes on unabated. Make use of it. So currently, we only have just below 5% of the capacity in the parallel system used. Some of the measures that we want to implement from today, the health recommendations, we are going to once again, and that message has gone out to all CEOs of the RHAs, to strictly enforce the one visitor per patient rule. It is not one visitor at a time. That was in place, but like everything else, we may have dropped our guard. So one visitor per patient, and visiting hours are still restricted to 1 hour per day. Another measure, which I have the full cooperation of Ms. Carolyn Ruiz, with whom I spoke this morning, She's president of the association that handles homes for the aged. There are about 175 to 200 members. We had started, if you remember, about 2 weeks ago to relax the visitation policy, where we were starting to allow visitation. Unfortunately, we have had to revise that. And as of today, we are going to go back to the measures where in these homes, we are asking that no visitors be allowed. This is to protect the most vulnerable group, that is the elderly, immunocompromised, those who are bedridden, those with NCDs, and so on. The two major breaches in the public health measures that we asked to be implemented, which have led to this new caseload, is this: wearing masks. From today, we are not making masks mandatory by law, but it is a strong, strong recommendation that masks be worn once you are out in public. We are asking business owners to strictly enforce the no mask, no service policy. And this is how business can help us minimize future business closure. We are all in this together. So we are asking for the cooperation of the business sector and patrons. Don't let a security guard because I'm getting complaints from security guards that customers are being hostile with security guards when guards ask them to wear a mask. The guards are simply looking after your health and the health of patrons within, which is a pharmacy, a grocery, a hardware. So don't take it out on the security guards, please. But we are asking business owners to be very firm with the no mask, no policy position. The other failure of the non-adherence to public health measures, which led to the closure of a school and those businesses, is that stay home if you are ill. We are pleading with people, if you are ill, self-isolate, separate yourself from your family members, get tested. The reason Maraval Roman Catholic School had to be closed was because a child who was known to be ill by their parents was allowed to go to school Monday, Tuesday, and Wednesday. And we keep saying the prize that we have in mind is the opening of our school system in September. So the virus is still with us as predicted. As predicted, it has manifested itself in the last couple of days. So we want to reiterate from the Ministry of Health's position that we are asking for all public health measures. That is, wear a mask when you go out and wear it properly, please, over your mouth and nose. Adhere to the physical distancing protocols as far as possible. Most importantly, stay home if you are ill and get tested. Hand sanitization, hand hygiene is important. How you cough and sneeze is important. Avoid touching your face and clean hard surfaces, example, tabletops, doorknobs, cell phones, as often as you can. We are not at this time contemplating any further lockdown of the economy, any further restrictions. We are just simply asking that these simple public health measures be adopted as a way of life. The virus is going to be with us for the foreseeable future, the next year or two. So these measures are now part of our daily routine, And we are asking the full cooperation of the society at large, business people, and again, as I close, we do apologize to the entertainment industry. We were poised to give you some more freedom there, but recent developments put public health measures above everything else at this point in time. So, Minister Cox, that's my report this morning, and I thank you for the opportunity.
Thank you very much, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update. Dr. Parasram.
Hi, good morning, honorable ministers, members of the media, members of the viewing and listening public. The clinical update for Saturday, 25th July 2020 is as follows. The number of samples submitted thus far to the Caribbean Public Health Agency as well as the UE site are 6,500. Number of unique patient tests now stand at 4,967. Number of repeated tests, 1,533. Number of samples which now test positive are at 147. Number of deaths remain at 8. Number of persons discharged thus far stand at 128. The number of community tests in the public sector are now at 2,515. Of note, over the last 2 days, the community tests have gone up by 233. And just to give an example, over the week ending 11th of July, which is 5th to the 11th of July, we would have done 112 tests in that entire week. Now, over the last 2 days, we have seen an upsurge in viral illness coming to our health centers presenting, and we have been able to sample 233 of those over the last 2 days. So, in keeping with our press release as of this morning, we noted that there were 5 additional positives overnight. Now, those 5 additional positives were directly linked. They are primary contacts in the household of the case 142. So that is case 142 all the way up to 147. All 6 cases are from the same household and linked to the same source. In terms of the quarantine patients thus far, we have 154 persons quarantined. At the Debe Penal site, there are 24. At the Tacarigua site, there are 21, and at the Chancellor Hotel, we have 17. Within the Cascadia Hotel, we have 33 persons. At the Regent Star Hotel, there are 14 individuals. And at the Home of Football, we have 43. As Minister indicated, there are 2 quarantine individuals at Cora, so our total is at 154. Just a brief update in terms of the cases thus far, the last few cases. So case 139, which was the most recent of what we had categorized as possibly local, all primary contacts are negative thus far, and this includes both the contacts in the household as well as the contacts in the affected business places, and all necessary public health measures continue thus far for the secondary and tertiary contacts to decrease the likelihood of any further spread from that particular case. In terms of case 141, so far again, no primary contacts positive from this individual. The community surveillance continues, especially to monitor the secondary and tertiary contacts, and swabbing will occur as required. With regards to case 142, as I said, all primary household contacts, all 5 persons are now positive, and this includes 3 children. Minister alluded to 1 child which attended the RC school, and that school has since been closed. So now that this child is positive, those persons, students, teachers, etc., in that school will be considered primary contacts, and as such, all of the primary contacts, in addition to their contacts, for instance, their parents, their siblings, will now be placed into home quarantine for a period of 14 days and be followed up rigorously with monitoring and evaluation for signs and symptoms, and the assistance of the TTPS is being afforded to us to ensure that those persons abide by the home quarantine laws. So they will be followed for 14 days and swabbed as required again. In terms of numbers, we have 76 children in that school. We have at least 12 or so other persons, so we close to 90 individuals as primary contacts from that 1 child, and our secondary contacts will be upwards of 200 in that particular instance based on the households. 1 other person from that cluster, which is 5 persons, would have been out and about as well with symptomatology in the last few days, so we have an additional primary and secondary contacts from those persons, and they as well will be placed into 14-day quarantine. So in terms of the public health measures, Minister would have already gone through all the public health measures, and as he said, the critical ones are mask wearing, and most critically, to stay at home if you're ill. Just to give an example, if the child had stayed at home when he was ill, we would have lost already 300 contacts, possible contacts, and decreased the risk of community spread. Minister Cox, that's my update for today.
Thank you very much, Dr. Parasram. The Minister of National Security, the Honorable Stuart Young, will address the enforcement of regulations.
Thank you very much. Good morning, Ministers Cox, Minister Deyalsingh, CMO Parasram, members of the media, wider viewing and listening public of Trinidad and Tobago. As you would have just heard, both the Minister of Health as well as the Chief Medical Officer indicate within the last few days, Trinidad and Tobago has presented with a very different situation to what we were dealing before with these last COVID positive cases. And in particular, what the CMO just alerted us to is the spread of COVID positive cases just from persons not doing what they're supposed to have been doing, and how quickly the contact tracing has to be done. The Ministry of National Security is working closely with the Ministry of Health to provide whatever support we can, both in terms of the policing for quarantine, but also in terms of tracing with the use of technology. I have this morning spoken to both the Trinidad and Tobago Police Service as well as the Trinidad and Tobago Defence Force, as well as our intelligence services, and we had a security briefing both on the COVID effects and the weather patterns, which I'll come to at the end of this. With respect to the COVID, I have asked the Trinidad and Tobago Police Service to enforce the regulations and health protocols that are currently in place. There was a certain amount of flexibility being given before as we ease back on persons, but I'm putting the population on notice now. The Trinidad and Tobago Police Service will be enforcing the current health protocols and regulations, starting with the no gathering of more than 25 persons in public places. No gathering of more than 25 persons in public places. We have found that there are areas of congregation taking place outside of bars and other establishments where people go to lime. The police have been instructed to please enforce the regulations. This is also applicable to the current election campaigning that is taking place. Political parties and our supporters are being asked to please abide by the regulations. The police will be first of all asking crowds to disperse, giving persons the opportunity to break out into groups of less than 25 or in certain situations to disperse and go back to their respective homes if the police deem it to be a public health hazard. Persons who do not abide by the police request to disperse may then be subject to arrest by the Trinidad and Tobago Police Service and the use of the regulations, which can be imprisonment for up to 6 months and a fine of $50,000. Obviously, we don't want persons to be subjected to these applications of the criminal law for breach of the regulations. So we're asking people, please, you've heard what has happened with the latest case in Trinidad and Tobago and how one quickly multiplied to 6 just in one family. How one student going to school has now potentially exposed over 70 other students. And then those students, of course, go home to their families. And then, of course, their families go outside. Understand, Trinidad and Tobago. These regulations were put in place on the basis of medical expert advice and will be enforced by the Trinidad and Tobago Police Service for the public's safety. We'd also like to say that clubs and party boats, as the Minister of Health has just alluded to, whilst we're looking at rolling back and allowing it, at this time, unfortunately, we can no longer do so. The next issue that has arisen very frontally for national security is illegal immigrants and the entry of illegal immigrants into Trinidad and Tobago and their circulation in Trinidad and Tobago, presenting a potential risk, a health risk, and other risks. So we have been moving with respect to this in national security. And what I'm asking here this morning is anybody with information with respect to these activities, because, as I've been seeing in the media in the last few days, it is Trinidad and Tobagonians who are part of this. We have locals, Trinidadians, who are part of these organizations engaging in the importation of illegal immigrants and facilitating it. The police service is going to be investigating these instances and charging persons for it. We're asking that anyone with any available information, please dial 555. We're dedicating that line, which is being manned by the Trinidad and Tobago Police Service. Telephone number 555. Please provide us with any information, credible information that you may have with respect to these illegal immigrant activities. I also want to say the Trinidadian drivers and the boatmen who are participating in this, the police have received advice that you will be charged, and I've asked them to ensure that persons are charged with trafficking in persons in contradiction and in breach of the Trafficking in Persons Act. So illegal harboring of immigrants as well is another area we're looking at, which is in breach of the Immigration Act. So the police are going to be launching operations. We have picked up a number of Trinidadians via intercept on boats, bringing across Venezuelans who are illegal immigrants, and they are going to be charged. The police shall be charging them. Right now, in accordance with health protocols, we have them in quarantine, and they will be facing the criminal charges that they deserve. It is the Trinidadians who are harboring illegal immigrants and also participating in this activity. The Trinidad and Tobago Police Service and our intelligence services are launching operations. We've had them ongoing investigations, and we intend to start the police will intend to start laying charges very, very soon. These persons are putting the population at risk. As you know, it is impossible to fully man every square inch of maritime border. The Coast Guard have been doing the best they can. The Police Service and the Defence Force on land have been doing the best they can. Locals and our nationals who have information, please give it to us at 555, because we will be going after these perpetrators. There are a number of videos that are circulating. All of them are being investigated. The videos that you see taking place in Chaguaramas with fishing vessels going, as you are aware, cargo and food items were always allowed, but persons are not allowed to disembark. An active investigation is taking place with respect to that, and I've also asked that if there are local Trinidadian businessmen who are facilitating the breach of regulations by permitting persons to disembark and permitting persons to come off these vessels into Trinidad without permission, and none of them have permission, that those Trinidadian businessmen are subject to be charged as well, and also to have revocation of whatever licenses. We are not going to allow persons to breach the regulations and put the public at risk. Another point I'd like to make, the legal Venezuelan migrants who have Venezuelan registration cards, the exercise that we conducted last year and we've extended till the 31st of December this year. If you are found engaged in any criminal activity, including the harboring of illegal immigrants, your cards will be revoked. I have given the instructions, and ultimately it's the Minister of National Security who grants the permission on those cards. Any Venezuelan migrant who is found conducting himself or herself in assisting this illegal immigrant harboring and bringing in illegal immigrants into Trinidad and Tobago, putting us at risk, your ability, your authority, your permission to be here is going to be revoked, and you will be deported as well. It is illegal to breach our borders. We just remind persons of that. So all of the boatmen who want to go and try and transact this business, you're breaking the law by crossing the borders and also harboring illegal immigrants. And we will be taking the necessary action with respect to persons doing this. Another area that we addressed this morning in the security meeting is that of landlords. Landlords in Trinidad and Tobago, you would know whether you're harboring, whether you're renting to persons who are illegal immigrants. That is a breach of the law under the Immigration Act as well as the Trafficking in Persons Act. So we're asking you, please, when you're renting your premises, please inquire and see whether these persons have permission to be here in Trinidad and Tobago. If not, you too are putting us at risk, and you too may be breach of criminal law and subject to potential criminal charges. There is just one issue I'd like to raise. You all would have seen that Caribbean Airlines put out an advertisement yesterday. Caribbean Airlines is working very closely with the Ministry of National Security for us to get a flight, possibly a couple of flights, up to the United States to take our students or Trinidad and Tobago students who need to go back to school. We'll be flying to Miami, and then students can make their way from the hub of Miami to their various schools wherever they may be around the world. This flight, of course, is going to be timed so that we can start the repatriation of our Trinidad and Tobago nationals. Of course, we have thousands of nationals in the United States. The flight will not be able to take thousands, so we're dealing with that. But also right now, as you heard the CMO say, our quarantine facilities are full. We're expecting over 80 persons as well within the next week or so to be coming back from the United Kingdom. So we're timing this repatriation flight from the United States back to Trinidad and Tobago, and we're looking as well at expanding our facilities, our state quarantine facilities, as well as the state supervised quarantine. I'd like the public to know that we've been asking persons who've applied for exemptions whether they can pay for state supervised quarantine, because that can assist in getting back persons sooner. A lot of persons are not in positions as we expect to be able to pay for it, and that is not going to put them in any unadvantageous position or disadvantageous position. So we're working those numbers, and we continue to do so along with the Ministry of Health. The last thing I'd like to address, Minister Cox, is with respect to the current weather patterns and the storm Gonzalo. We have been monitoring it for the last few days. I'd like the country to know that the ODPM, or Met Services, the Met Office, as well as the various regional corporation disaster management units, the Ministry of Works and Transport, and then, of course, all of the arms of national security have been monitoring this and preparing. Timor and Tobago as well have been preparing for the touchdown of the effects of this now tropical depression. I think it may have been downgraded from a tropical storm, or is just on the verge, that is scheduled to hit Trinidad within the next few hours. What we got so far was a weather pattern that was in front of it. We are expecting, please stay tuned to the ODPM and the Met Services for further updates as the day goes on. One thing, unfortunately, we've already seen is the prevalence on certain persons being mischievous and putting out fake videos. So about an hour ago, you had persons circulating, and from a certain quarter, I'll say it, from a certain quarter, maybe even politically, certain persons circulating a video of what they claim was Toko, and that the storm had touched down in Toko, and showing very, very high and heavy winds. That is a fake video, so we're asking persons, please desist from the fake news and the misinformation and disinformation at a time like this. The population is already under enough strain. The Ministry of National Security, Ministry of Communication will put out what needs to be put out if necessary. At this stage, the ODPM and our Met services are putting out the necessary information for the public to be aware. We ask everyone to please stay safe, stay indoors if you don't have to go outdoors, continue to monitor the situation. You would have seen the various numbers for the disaster management units at the various corporations. There have been, I was updated on my way here, there have been a number of properties affected on the East Coast in the Manzanilla area. The regional corporations are on the ground there doing what needs to be done. The Trinidad and Tobago Defence Force and our police service are on standby. The National Operations Fusion Centre is giving us the oversight. I've been in constant contact with Met services as well as the ODPM. The ODPM has initiated our protocols and our process and have the team in place, which is a multi-agency team, to continue the monitoring and, if necessary, getting the resources to where the resources need to be. So at this stage, we continue to monitor. We have been preparing, so we are in a state of being prepared. I've been monitoring what has been going on in Tobago. Fortunately for Tobago, the weather pattern veered away from Tobago. Trinidad may have some touchdown within the next few hours, and we'll continue to monitor it. And if necessary, we will come back to you, the public, to provide you with further information. Thank you very much, Minister Cox.
Thank you very much. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. 98.1.
And to the panel, Stephen Cummings, 98.1 FM. And I will go, as usual, with my 2 questions quickly. One for Minister Deyalsingh and the other for Minister of National Security, Minister Stuart Young. I'll start with Minister Stuart Young. Minister, over the past several weeks, and you referred to it, we have seen and have had many dramatic and screaming headlines relative to the illegal entry of foreign nationals into Trinidad and Tobago. Headlines such as border breaches, Venezuelan migrant convoys stopped in Cedras, 45 arrested, and so on. With the recent uptick of COVID cases said to be local, including that of a minor, could it very well be other cases of importation of the virus, via these illegal entries? And is there a breakdown that you can give us that would state, or that we would see where, who these foreign nationals are in terms of where they would have originated from? Because I believe that we are not only talking about Venezuelan nationals, but there might be other nationalities who have somehow found their way into Trinidad and Tobago illegally. And Minister Deyalsingh, we started out very early talking about caseload, and we've had, of course, an recent uptick in cases. Can you give us, what is our current caseload per population at this time? Thank you.
Okay, thank you very much, Mr. Cummings. Yes, this is something that has had us concerned for quite a while. I mean, even before COVID, and as you know, we've been doing our best at National Security to try and prevent the entry of illegal immigrants. What we've also been discussing is we have to realize that Trinidad and Tobago is recognized internationally as one of the safest places to be during this COVID pandemic. So a lot of countries in South America, in particular Brazil and some of the other countries, are right now struggling with the response to COVID. And what we're finding and what we're being told and what our intelligence sources tell us is persons who may have migrated there before are now coming back into Venezuela. And this, of course, creates a domino effect. We are not seeing, quite frankly, any uptake. I can't ever help, I always smile, and you said it, Mr. Cummings, when you have these screaming headlines. The population will ask themselves those questions as to what these screaming headlines, etc. about. Our job is really just to do the best we can to protect the population. All of our assets are currently being utilized. As soon as we pick up any illegal immigrants, we have a system where even those who are not intercepted at sea but are picked up on land, for example, by Trinidad and Tobago Police Service, we take them immediately into quarantine facilities that we've set up, and we then make the necessary arrangements with Venezuela to have them repatriated. So that process is going on. So when we pick up the persons, they come into our health protocol system and we're dealing with it. And you're right, it is not only Venezuelans. I think right now we have about 3 individuals from the Dominican Republic in quarantine as well at our heliport, and we're dealing with that as well. And I'll tell you all, thank you for this opportunity. The Chief Immigration Officer advised me as the Minister of National Security that during this period, one of the things we should do, and I have done it, is a declaration by the Minister of National Security that any person who enters Trinidad and Tobago illegally, any non-national, any non-citizen who enters illegally, no matter what your nationality, you're automatically deemed to be an undesirable. I made this declaration under the Immigration Act and then immediately subject to deportation. So these are some of the measures we're engaged in to try and protect the people of Trinidad and Tobago from this global pandemic. And again, I'll use the opportunity to ask anybody with information, please dial 555, give us the necessary information so we can action it. Thank you.
Thank you. So, Mr. Cummins, thanks for your question. The caseload per million globally, so we can't take the TT figure alone, it must be contextualized. The global caseload per million is currently 2,055.5. 2,055.5 cases per million population. In Trinidad, our caseload is 105 per million. So it's significantly less than the global figure. The death toll per million globally is 82.6 per million population. So for every million people in the world, 82.6 people have died. The Trinidad and Tobago death rate per million is 6 per million. So again, significantly less, but we want to give these figures of Trinidad and Tobago, we want to keep them where they are. We can't take them down, but we certainly don't want to take them up. So whilst we are in a good place, comparatively speaking, we are not happy with what we are seeing in recent days, largely due to the failure of members of the population to adhere to the simple guidelines, stay home if you are ill, and to prevent further spread, wear a mask when you go out in public. So, Mr. Cummins, thank you very much for that question.
Thank you, Minister. TTT.
Hi, good morning. Ian Wilson, PTT News. I have two questions actually. One for either the Minister of Health or the CMO, and the other for the Minister of National Security. First question, a lot of parents are very concerned about sending their children to school, especially since case number 142, because we have children right now either preparing for SEA or the CSEC examination. So should parents be overly concerned about these latest developments? And two, the Minister of National Security did indicate that the police will be assisting in and will be enforcing these recommendations. But I just want to quote directly from the Commissioner of Police in one of his Facebook posts, where he said that I have not received absolutely no policy from any government official to stop any young person from taking part in sport. So this is just an example I'm using. What I would like to find out, what exactly would the police be enforcing, and also what level of enforcement?
Okay, Minister Deyalsingh watching me. You want to go first?
Okay, so yeah, I'll deal with the issue of parents' concern about schooling. And Ian, you are correct. Parents ought to be concerned. And when I addressed this on the unscheduled press conference on Thursday, I said, we are very concerned, but there is not cause for panic. What parents should be doing is adhering to the simple measures. Keep your child home if they are ill. And yes, whilst there are no regulations to stop anybody from playing sport, we have constantly asked parents to do the responsible thing. And we said clearly here again, we can't legislate for every single outcome, but it is time for a collective social responsibility. If I was a parent of a young child, if I was a parent, I will not let my child at this point in time go out and play team sports. If the child has to burn out excess energy, I will burn out that excess energy with the child by playing football at home, cricket at home, let them run around the house, whatever. That's what we have to encourage parents to do. We understand that being cooped up is not a good thing mentally, physiologically, all that. But we have 16 million cases of COVID in the entire world. 600,000 persons have died. These are not normal times. These are the new normals. And the new normals demand of parents to protect your children, but at the same time, keep them occupied at home, kick the ball with them at home, let them run up and burn up all that energy. So whilst there are no regulations to prevent certain activities, we are asking for common sense to prevail.
All right, thank you very much, Minister Deyalsingh. To answer your question is a simple question, Mr. Wilson. The Trinidad and Tobago Police Service are going to enforce the regulations. This is about the enforcement of the regulations, the enforcement about the law. I'm not getting drawn into that ongoing tennis match that is taking place. With respect to the regulations, what the Trinidad and Tobago Police Service are going to do is enforce it. So gatherings of persons over 25 in public places, that is not going to be permitted. At this stage, the regulations speak very clearly to what is permitted with respect to team sports, and it stops at the team sports. The Ministry of Health have a suggestion, they have advice. That is up to persons to take that suggestion and advice. Those are not the regulations. So with respect to what the Trinidad and Tobago Police Service are going to enforce, it is what is in black and white in the regulations. No parties, no clubs, no party boats, no more than 25 persons gathered in public spaces, and the other types of regulations. Bars must close at 10 o'clock. Restaurants must close at 10 o'clock. There's to be no in-house dining after 10 o'clock at restaurants, and no persons inside of bars. These are the regulations that the police service are going to be enforcing, what is written there in black and white.
Guardian Media Limited.
Good morning to the panel.
Morning.
This is Annalisa Paul at Guardian Media Limited. I am trying to find out. I have two questions. First off, I'm not sure if it's Minister Deyalsingh or Minister Young will take this question. In terms of the students that are still abroad, how successful has it been in terms of getting them funding? And I know that we as government had indicated that they would be making funds available to these persons who are still there. How successful has that been? And with regards to the second question being, now that we're seeing the restrictions of no more than 25, which had not changed previously, could we be seeing in the coming weeks or in the coming days rolling back on enforcement of restrictions regarding public transportation? Because maxis and taxis have now gone back up to the regular passenger capacity. So at this point, may we see a restriction on that?
So let me address the issue of
Thank
public
you.
transport, because that's a health concern. We are not at this point in time considering the restrictions in terms of percentages, whether it's 75% or 50%. But what we are strongly recommending, and which I have spoken about ad nauseum, is this: once you are using public transport, wear a mask. That's all we are asking. Whether you're in a 12-seater maxi, a 25-seater, a 4-passenger vehicle. As a matter of fact, the closer you are, especially in a 4-passenger vehicle, the more imperative it is to use a mask. I am seeing people in public transport, the drivers are not wearing masks. Some are. Some passengers are, some aren't. We have had the advice from the Attorney General in that making mask wearing mandatory is fraught with legal difficulty. So we are asking the population, do the sensible thing, do the right thing, do the responsible thing, and once you are out in public, especially if you are close to people in a maxi or a taxi, the closer you are, the more imperative it is to wear a mask to protect yourself, because, as we keep saying, you have to pretend that you have COVID and pretend the person next to you in the maxi, next to you in the taxi, next to you walking on Brian Lara Promenade, wherever, has COVID. And if we could do that simple public health measure, we could mitigate a lot of risk and keep the economy bubbling over as it has started to do so successfully. So that is the position on masks. Keep wearing your mask. Thank you very much.
Okay, Ms. Paul, to answer your first question, there was never an identification on this batch of students being sent money. It was that money would be sent to certain of our consulates or missions or embassies abroad in the United Kingdom, in Canada, and those in the United States to help our citizens who are there, who are most in need. We've had, fortunately, the first batch of repatriation from Canada. We're waiting on persons to arrive from the United Kingdom. The focus now turns to the United States. But what you're also finding is students saying, well, look, I have to start back school in a few weeks' time, a few months' time. So all of this is being balanced out. We are doing the best that we can, but we continue to maintain, based on the advice of the public medical healthcare experts, that the borders must remain closed. But more importantly, everyone has to go through mandatory quarantine, so the numbers continue to be limited. And if we were not participating in this mandatory quarantine and persons were just allowed to come back and go home and self-isolate, it is guaranteed the number of positive COVID cases would be more. So we know it is difficult. It is very difficult when you're reading these pleas and these cries of our citizens abroad. It is something that we have a lot of empathy for. We're doing the utmost best that we can. Our quarantine facilities are currently full. We continue to have a system where they are always going to be full. Understand if there are positive cases, there must be then an airing out period, and all of these things are being factored in. Yesterday, I will say this, yesterday I spent time with the state's legal team, because of course you have the opposition challenging the border policy. So despite what you may hear them saying and the leader saying, Anand Ramlogan, their former Attorney General, and his legal team are filing lawsuit after lawsuit designed to disrupt and to overturn our border policy and to break that chink in the armor to then put us all here at risk.
Thank you very much. AZP News.
Hi. Good morning, to the ministers and to Dr. Parasram. I have two questions, and one is to Minister Deyalsingh.
Sure.
Now, when you started speaking, you mentioned about the beds that are currently in use, and you said that there were 13. However, from the release this morning, you said that 11 patients at the Cora Hospital. Clarify.
Sure.
And my second question for Minister Young, can you indicate from when illegal immigrants would have entered the borders, and also will measures have been put in place in the event that they would have had contact with residents for testing and so on? Thank you.
Okay, so thank you for the question. So I did say at the end of the day today, we will have 13 people in Cora. I was very careful to say by the end of the day today. There are not 13 people currently there, but if you go back to the start of the tape, I did say by the end of today, we will have 13 people in Cora, okay? Hope that answers your question. Thank you very much.
Minister of National Security.
Thank you very much. I mean, you asked the question, can I indicate where the illegal immigrants are entering from? The answer is they're entering from breach of the maritime borders. They would be entering at a number of beaches around the country. Trinidad and Tobago is an island. They're entering at illegal beaches, illegal ports of entry around the country. But you touched on a very important point. Can I indicate whether they're having interaction with locals? We can only assume the answer is yes. And that is why the warning, forget what the law states, but the warning from a health perspective to all of these locals involved, because the truth is locals are involved. So whether it be the communities, the residents, etc., or those who are transporting them, there are locals involved in this scheme of human trafficking and in this scheme of bringing illegal immigrants and migrants to Trinidad and Tobago. And that is what we're asking. When you are in a community, if you know it's Mr. X, Miss Y, who are engaged in this activity, call us at 555. Give us the information. because those locals are now putting the rest of us in the population at risk. Right? It is no longer only about illegal activity, which is something we're constantly fighting. All of the local persons, including the landlords who want to profit from harboring illegal immigrants, they are all putting us, the rest of the population, at risk from the spread of COVID and other viruses and related health problems.
Okay, we go to TV6, please.
Hi, good morning.
Morning,
Vanessa Cutting, TV6 News. Good morning. We've been having a lot of unconfirmed reports that a number of the recent local cases are connected to non-nationals. Could you state at all whether this is the case and how, if there's any possible language barrier to the tracing process and how that is being taken care of? And to the Minister of National Security, because we also got a report that one of the cases was harboring non-nationals. Could you say whether this person would be forming any part of the investigation that is currently underway?
Okay, thank you very much. The answer is at this stage it is premature for us to say anything with respect to the contact tracing. The Ministry of Health has a very competent team that are doing the contact tracing along with the assistance, whatever assistance they need from national security. And at the appropriate time, if evidence is unearthed as to where exactly those contacts may have been and whether there are illegal immigrants involved, then that would be told to the population at that time. Right now, the contact tracing, as Dr. Parasram told us, is underway, and the primary contacts are being traced and tested and these types of things, which is why we have 5 new cases this morning with the last case. With respect to the language barrier, no. Language barrier does not prevent us from doing our investigations. In fact, this morning, in speaking to the Trinidad and Tobago Police Service overnight with respect to 5 illegal immigrants that were picked up, being transported in at a house that we executed a search warrant on. Those 5 illegal immigrants are currently being interviewed, and we use translators. We have a number of translators that we use, so nothing holds us back from the necessary investigations.
On the language barrier, the Ministry of Health's perspective now, we engage the services of Solnet to help us speak with the Venezuelans. We also have 2 doctors on the team that reports to me. Dr. Avery Hines and Dr. Mariam Richards are both fluent in Spanish. So we have had no problems communicating with anybody in their native language, if it is Spanish, either through the Ministry of Health or by using agencies like Solnet. Thank you very much.
Thank you. Mr. National Security, someone wants to know how did the contact of positive number 139 reach to Tobago, by boat or plane, and what will happen to persons who travel with the same mode of transport?
All right, so fortunately, once again, due to the efficacy of the Ministry of Health and their personnel, we have already addressed this issue. So the primary contacts with respect to case 139 that were in Tobago went across by the fast ferry. Fortunately, on the fast ferry, there's a lot more social distancing taking place, and if necessary, the contact tracing is underway with respect to that case, and they're trying to determine. We also use CCTV camera footage and other means of determining how to trace persons who may have been in contact. So that is currently underway. Fortunately, with the ferry as well as with our air service, they are supposed to be, and my understanding is they are doing it, they do a sanitization between every trip. And it's quite a robust sanitization.
And just to fill out the answer, the persons were in fact contacted in Tobago within quick time, and they are under quarantine in Tobago for the required 14 days.
Newsday?
Good morning. With the rainy season coming up, we know that there are a lot of viral illnesses besides COVID. Of course, now that we have some spread, is there concern that there, of course, with sneezing and people actually sick with viral illnesses, there could be more cases, an increase of cases of COVID-19, as well as other viral illnesses and even dengue. Is the various health systems prepared for that, and what is being put in place?
Yeah, so thank you very much. So, as the CMO indicated, one of the reasons we are seeing an uptick in community testing is that people are presenting now as the lockdown measures cease and as people move more and more, you are seeing an uptick in viral illnesses, and that is why our community testing is proven to be so successful at this point in time. Our dengue caseload continues to drop year by year, and we are always prepared at the start of the rainy season. But again, and I want to thank you for the opportunity. The major contributor to dengue is not what the government does or does not do. It is how the population encourages the breeding of mosquitoes in their houses and in their homes by providing breeding sites, by having barrels of water, buckets of water, paint cans of water, flower pot saucers that collect water, vases inside your home that collect water. So the reduction of dengue is a joint partnership between the state, and we always say we cannot overspray because we must spray in a 4-month cycle, because if you spray too often, the mosquitoes build up resistance and then you create a bigger problem. So a major part of reduction of mosquito-borne diseases, whether it's Zika, chikungunya, dengue, malaria, a major part of it is not only the responsibility of the state, but the responsibility of house owners and the community to rid your yards of breeding sites. So I really want to thank you for that question and give me a little plug to go into dengue. Thank you.
Thank you. At this time, I want to go back to the CMO. I think he wants to add something concerning the question concerning travel.
Yeah, so with regards to case 139, as we said before, 3 persons would have gone across to Tobago as primary contacts of that case. They have all since tested negative. I have conveyed that information to the CEO of the Port Authority, who, of course, that with that new information, it means that the risk of transmission during that journey would be little to none. So that at least the persons who would have traveled on that trip can be reassured, and the Port Authority can be reassured of that.
Thank you very much. We've come to the end of today's virtual media conference, and do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. And as we go, we want to appeal to everyone to observe the COVID-19 protocols in place to prevent possible community spread of the virus. The new cases over the past few days in Trinidad and Tobago are cause for concern. Our public health officials reported that there is a marked decline in the number of persons wearing masks, and there should not be. Please let us remember the importance of wearing our masks. The Ministry of Health issued guidelines for our new normal and the reopening of the economy recommend the use of masks in public spaces. Masks protect us in crowded areas, in situations where it is difficult to maintain physical distance, and if you are ill. It is critical that you wear a mask inside your home to protect your loved ones. Patrons and bar owners must also do their part to ensure we keep the curve flat. We are still living with the pandemic, which means you must comply with public health guidelines which stipulate the closing time of your establishments. You should ask your patrons to wear masks where necessary, do temperature checks, and insist on hand sanitization. These measures are important if we are to keep Trinidad and Tobago safe. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe. Save lives.